like she said, I'm not Blessing, and I'll be talking about menstrual hygiene. Okay, so many of us are familiar with menstruation, right?
Yes.
Some of us have already started our menstruation, right?
Yes.
Okay. So does anybody have an idea? Maybe can you like define menstruation for me? You have any? Just a okay. Thank you. Okay. Okay. Thank you. We did you all hear her? In simple terms, menstruation is the discharge of blood, right, from the vaginal orifice of a woman due to the uterine lining shedding. Like your uterus now is trying to cleanse itself from the dirt inside. Do you understand? Do you understand?
Yes.
Okay. I'm going to ask questions at the end. Do you understand? Is that right? Okay. So how do we calculate this menstrual cycle? Menstruation actually takes 28 days to go around the calendar, right? For you to see another cycle. So it takes 28 days, and for you to start counting that menstruation, it starts on the first day. The first day you see blood drop, that is when you start calculating. You calculate the 28 days and you start seeing your next menstrual cycle, right? But in some cases, in some special cases, some women tend to see before the 28 days, February 24 days, some see after 28 days. But if it takes longer than, let's say, 5 days, let's say add 5 to 28, and you don't see your menstruation, I believe it's better, maybe it's continuous, then it's better for you to see a doctor. Don't keep quiet about it, because this leads to future problems that you will not see now, maybe till you get married and all those things, right? So what actually delays menstruation? One of the most popular things that we know that delays menstruation is pregnancy. Definitely, when you get pregnant, you cannot menstruate. Okay, another thing that causes delay in menstruation is infection. When you have UTI, that's urinary tract infection, or popularly known as toilet infection, like we all know it. When you have those infections, now those things will cause delay in your menstrual cycle. Then also we have stress. When you are stressed out, or let me say you play a lot, you don't rest, you just play, you are stressed in the morning till night, you are busy doing this, doing that, and everything, and you don't have time to rest. It's also one of the reasons why your menstruation will delay. Then lastly, we also have hormonal imbalances. Hormonal imbalances can be due to drugs, some certain kind of drugs. There are some contraceptives that you take. Yes, these are teenagers, okay, let's say adolescents, they take contraceptives to prevent pregnancy, right? To prevent pregnancy, like all these Postino 2 and others, they take to prevent pregnancy. Most of these cause hormonal imbalance with us. So once it causes that hormonal imbalance, your menstruation will begin to skip. It might take 2 months, 3 months before you see your menstruation. So another okay, for the disease part, there is a condition known as PCOS. It's known as polycystic ovarian syndrome. Poly means plenty, cyst means a sac with fluid, tiny sacs with fluid. Ovarian, we know now, ovaries. So in combination now, we get plenty sacs on your ovaries. And also this PCOS, there's also presence of the male hormone. That's where you see women having hair in their chest area. So if you see some kind of things like that, I think it's better for you to see the doctor, so that at least it's seen early, it can be treated early, so that in your future, okay, when you get married and all that, you'll be able to get pregnant. At least it's managed from the onset. Okay, so what is menstrual hygiene? It simply means keeping yourself clean during this menstruation to prevent future problems, right? So how do we take care of ourselves during this menstruation? First of all, you change your pad. 4-6 hours is enough. You change You wash. You make sure you bathe. If you cannot bathe, maybe you are in a school or something, somewhere not convenient for you to take your bath. You can just go wash yourself, right? Then you just wear your pad, just change the pad and you wear. Then you roll, discard it properly. Then maybe when you get somewhere, you throw it. Then we'll be teaching you how to fix the pad.
You are making noise. You are making noise. And it's like the noise is coming from those ones that don't even know what we are doing. You open.
You have to be careful. So they're very well now.
Can you see? This is the long side. You can see how wide. So this is the back. And this is the front. The front usually used to be slimmer than the back. So you see. Make sure it's well. Then you remove this one. Are you seeing? Yeah. Baba. Make sure don't let it come together because there's a little bump here. So the moment this place closes, you can't use the gum here again. Because the moment you're trying to open it, you're spoiling the pad. And that's all.
So now, wow. What a masterpiece.
You understand? So when you are disposing your pad, Nurse Blessing said you can throw. But these days, you know, the community is not, they are actually using it for practice, you understand? So it's better you burn it. Or when you have a pit, you throw it inside. So when you are disposing it, I'll remove it. Roll. When you are waiting, don't touch. And that's why you be careful. That's why you be careful. So when you roll like this, you roll it inside. You roll it inside. You roll it inside. Then you start.
Anyway, thank you very much. Do you have any questions? No questions. Okay, so we have a little something for you.
Before me, behind me, beside me, inside me.
Have you got it? Have you got it? Have you got it? You have got it? Stop scared.